Bismillahirrahmanirrahim. Today we talk about the anatomy of diaphragm. So diaphragm is a dome-shaped muscle or a septum. It's a muscle and it's work like a septum. So diaphragm is an inspiratory muscle. Diaphragm is an inspiratory muscle and it works like a septum. How it works like a septum? Suppose this is a human body and this is the person's trunk. So this trunk is divided in all of us into thorax and abdomen, the upper thorax and the lower abdomen. The thing dividing the trunk into thorax and abdomen is called the diaphragm, hence it's working like a septum. So when we say diaphragm is dome shape, so a dome shape usually looks like this, and when we talk about convex shape, this is convex shape. And when we talk about concave, so concave shapes usually look like this. So the convexity of diaphragm is in the thorax. We know this dome shape is the diaphragm. Above it we have the thorax, below it we have the abdomen. So the convexity of diaphragm is in the thorax and the concavity of diaphragm is in the abdomen. So diaphragm is making the floor of the thorax and the roof of the abdomen. So diaphragm has two domes, a right dome slightly higher than the left dome, a right dome that's slightly higher than the left dome. And furthermore, we know that above it we have the thorax and below it we have the abdomen. When talking about diaphragm, we consider this diagram now. So in diaphragm we have a peripheral part. The part I'm highlighting is the peripheral part, and in the center this shape, this trefoil shape I have drawn, is called the central tendon. So what I mean to say, so this part which is highlighted is the peripheral part. So this peripheral part consists of the muscular fibers, whereas in the center all these fibers, all these muscular fibers converge and form the central tendon. Central tendon is nothing. These all muscular fibers of diaphragm are converging together in the center and forming a tendon called the central tendon. This tendon is the insertion of diaphragm. What's this called? It's called the central tendon. Now we talk about the origin of diaphragm. We know very well when we talk about any muscle, we talk about its origin, its insertion, its blood supply, nerve supply, and functions. So now we see the origin of diaphragm. The origin of diaphragm is from three places. It have a sternal origin, a costal origin, and a vertebral origin. So the sternal origin of diaphragm is from the xiphi sternum. And from which part of the xiphi sternum? Which surface? Xiphi sternum's posterior surface, not from the anterior. It's from the posterior surface. Okay, so the costal origin of diaphragm is from the lower 6 ribs and their costal cartilages. Lower 6 ribs and their costal cartilages. Okay, from which surface? From their inner surface. From their inner surface. Okay, the vertebral origin. The vertebral origin of diaphragm is from the lumbar vertebrae in the form of ligaments and the crus of diaphragm. Okay, so here I have drawn to you some vertebrae, and you very well know that in between the vertebrae we have the intervening disc. Okay, so these are the intervening discs. When we talk about the vertebral origin of diaphragm, so it's in the form of the crus, the right crus and the left crus of diaphragm. So the right crus of diaphragm originate from L1, L2, L3 and their intervening disc. When we talk about the left crus of diaphragm, it originate from L1, L2 and their intervening disc. So this is the right crus of diaphragm and this is the left crus of diaphragm. This is the right side, this is the left side. Okay, so now when we have talked about the right crus and the left crus, let us talk about the ligaments too. We know that next to these vertebrae we have two muscles, psoas major and quadratus lumborum. Here also we have psoas major, and quadratus lumborum. The fascia covering the psoas major muscle is called the psoas fascia, and the fascia covering, there is also fascia covering the quadratus lumborum muscle called the quadratus lumborum fascia. So the thickness of the psoas fascia is called the medial arcuate ligament. The thickness of psoas fascia is called the medial arcuate ligament. The thickness of quadratus lumborum fascia is called the lateral arcuate ligament. When we talk about the median arcuate ligament, so at the level of T12, we know that we have the aortic opening. We'll talk about it later, but right now, at the level of T12, we have the aortic opening. In front of the aortic opening, the fibers of right crus and the left crus unite and form a ligament which is called the median arcuate ligament. Okay, so this was the aortic hiatus. In front of the aortic hiatus, the right crus and the left crus unite to form the median arcuate ligament, and the thickness of the psoas fascia is called the medial arcuate ligament. The thickness of the quadratus lumborum fascia is called the lateral arcuate ligament. So that's all about the origin of diaphragm, and we are continuing our topic in the next video. Thank you so much.